Rogers. I'm Brittany. I'm going to be your nurse today.
Hi.
How are you doing?
I'm good. How are you?
I'm good. Do you have any primary concerns?
No, I'm just here for the regular college physical.
Okay, all right. Well, I'm just going to ask you a few questions first. How much do you exercise?
I exercise probably 2 to 3 times a week.
Okay. Are you taking any medications?
Nope.
Okay. Do you have any allergies?
No, not that I know of.
Okay. Do you smoke?
No.
Do you drink?
No.
Are you sexually active?
Yeah.
Okay. How many partners have you had in the last 6 months?
Just one. Me and my boyfriend have been dating for about a year now.
Okay. Do you guys use protection?
No.
Okay. Are you aware of the risks of not using protection?
Well, I could possibly get pregnant, but...
Okay. Yeah, you can get pregnant and also your risk for sexually transmitted diseases. Pregnancy can alter your life in many ways as well as financially. Do you have a job?
No, I live at home and pretty much rely on my parents for everything.
Okay, well, like I said, babies can be very expensive. It takes a lot of medical visits during pregnancy, as well as the cost of taking care of a baby and going to college. Have you ever had a visit with a gynecologist?
No.
Okay, well, it's recommended that once you turn 18 or become sexually active that you start visiting the gynecologist. And since you are both 18 and have started having sex, it would be important that you make an appointment and just make sure everything's normal. So while you're there, the gynecologist will take a pap smear and will recommend for you to get the HPV shot.
What's HPV?
Okay, well, the HPV shot will help prevent you from the human papillomavirus, which is around 100 different viruses that you can get from sexual contact. It's 3 injections over 6 months, and here's a handout that will help teach you a little bit more. It talks about what HPV is, why you should get the shot, what are some risks, and a couple of different things like that.
Okay.
You said you haven't been using any protection, is that correct?
Correct.
Okay, well, like I said, unprotected sex puts you at risk for pregnancy and STDs. Some symptoms are don't show up. You could have an STD and you wouldn't know it, but some are prevalent, like abnormal discharge or painful urination. Some STDs are curable with antibiotics and some are not. Here is a chart of different STDs that can help teach you, such as chlamydia, which is treatable, but if you don't treat it, your reproductive organs can be severely damaged and you may not be able to have children in the future. And there's a couple other STDs that are not treatable, like HIV, which can turn into AIDS and eventually lead to death. So it's important to get that checked out as well as your partner. All right, well, also it's important to invest in some sort of protection to help prevent from pregnancy and STDs. Condoms will help prevent STDs and pregnancy, and here's a handout on condoms and how to apply them. It would be a good idea to go over this with your boyfriend. It also has some safe sex practices in here, so if you want to go ahead and read over that, there's that. So what actions are you going to take to promote a healthier lifestyle?
I'm going to go visit the gynecologist, get some sort of protection, condoms, and I'm going to get my HPV shots.
Okay, all right. And like I said, condoms are a good idea, but there's also other contraceptives such as birth control. So, and your doctor can help prescribe that. So, all right. Well, we're going to continue with your physical. So, I'm just going to leave the room really quick. If you could put on a gown for me.
Okay.
Thanks.